If you're honestly evaluating your work, you will find things that are not working well and need to be improved. You also unlock the capacity to pivot if your best intentions, your wisest plans, aren't panning out as you had imagined. With continuous improvement, we can understand the reasons for failure and use this knowledge to change direction and chart a clear path to success. It is hard to experience failure, disappointment, heartbreak. Despite all your best efforts, sometimes you lose. But we can also look at failure as a miraculous gift that shows the way to a future success. In Ghana, bold innovation and continuous improvement are saving many infants' lives today, a successful outcome born of initial failures. Dr. Twum Danso is a public health and preventive medicine physician. She's the founder and CEO of MAZA, a social enterprise that provides transportation for urgent medical needs to rural communities in Ghana. Her previous work in Ghana included serving as director of the nationwide Continuous Quality Improvement Initiative in maternal, newborn, and child health in Ghana. She began her career as the Task Force for Global Health in Atlanta, Georgia, where she worked on research, program implementation, and policy development for several neglected tropical diseases. She is currently Senior Vice President Global at the Institute for Healthcare Improvement. Hello, Dr. Twum Danso.
Hi, Zainab. Great to see you.
Tell us about infant deaths in Ghana.
Ghana, like many other countries, had made a lot of progress in deaths in children under 5, including the older infants. But where the country struggled was on the newborn deaths. Part of the reason is that most of those deaths are happening on the first day of life. One of the most common reasons why babies are dying on the first day of life is asphyxia, where they have difficulty in the birth canal, and then the first few minutes of life. A large-scale program was designed in Ghana to help the midwives and the nurses who are delivering these babies in the rural areas recognize the problem, resuscitate the babies, reassess them, and if the babies weren't doing well, refer them to the next level, which would be the district hospital or higher.
What did you discover as you measured success of the program?
So my team and I were brought in as independent evaluators to assess what went well, what didn't work well. And what we saw in the data was that as the program was being rolled out, the referral rates for newborns from the lower levels to higher levels increased quite dramatically. In parallel, newborn deaths also increased, and that was anti-intuitive. We didn't expect that. The thinking was that newborns that are struggling at the lower level, refer them to a higher level and they will do better. We didn't see that, and that was very disappointing for everybody involved. However, we noticed that there was this one region that had actually had the similar pattern and then reversed it. So we probed to find out what they had done differently. What we learned was that they had seen the same thing that we had seen in the overall data, and they realized that the midwives at the lower level of the health facility were referring a lot more than they had done in the past. And when they spoke with them, they said, well, that's what the training said. You reassess. If the baby's not well, doing well, refer them. But the distances from the clinics to the hospitals were quite vast. Ambulances were few and far between, and other types of transportation were quite scarce and expensive, right? So trying to keep a newborn alive for 2-3 hours on a bumpy road from a clinic to hospital is really hard. So what that region did, of their own accord, this wasn't part of the program, was provide coaching and mentoring to the midwives at the clinic level so that they could stabilize the newborns and keep them locally because of the distance issue. Keep them locally, support them, and those babies did well. So we saw referrals go up, deaths go up, and then in that particular region, the curves went back down. It was reassuring to us that one region had taken the initiative to do their own assessment of their data and act on their data and actually see the improvement in real time. It was very, very encouraging.
Thank you, Dr. Twum Danso.